Okay, great. So thank you so much, Dr. Overbey, for being here with us today. So we're here on behalf of the Thoracic Surgery Medical Student Association. This is part of our series on advice for residency application and interviews. And just to give a brief introduction to Dr. Overbey, so he is an assistant professor of surgery at the Duke University School of Medicine, where he currently practices as a congenital heart surgeon. Dr. Overbey completed his general surgery training at the University of Colorado and then completed both his adult cardiothoracic and congenital cardiac fellowship training at Duke, where he's now the associate program director for Duke's cardiothoracic residency training programs. So thank you so much for your time today, Dr. Overbey. It's really a pleasure to have you.
Happy to be here. Thanks, Gianna.
So we're just going to kind of kick it off by giving any overarching advice that you may have for residency interviews in general.
So I think the first and foremost, you want to come up with a list of programs that you think are interesting for your particular desires and skill set and what you want out of a training program. And so that requires a lot of prep work because there's a whole lot of different historical advice people can give you that may or may not be relevant because there's so much movement in the field. There's a lot of people that come and go and transfer jobs. And so what you want is to have the current perspective on each training program and what those programs have to offer. And then you have to start narrowing it down, right, in terms of which programs work for you at a professional level for what you want and also for your family. And so there's a lot that goes into the decision making, but you want to make sure that you get a lot of advice from a lot of different sources in terms of making your initial list of programs. And then we can talk about how to narrow those down, but I think that's the most important part is for you to develop your own list and then rank all the programs according to, even before you go see them, which ones you think are going to be best for you. That'll allow you to do more targeted interviews and help narrow that down over time.
So when you already have that formulated list, should you kind of tailor when you schedule your interviews around that? And how do you kind of strategize like programs that you're really excited about? Where should they end up within the schedule?
That is a great question because it changes year to year in terms of when you get particular interview invites, right? So some programs give out interviews all at once and they give you kind of one date, take it or leave it. Other programs do staged releases. And so then over time, they have maybe tiers or they're going through different parts of the alphabet or different ways that they do it and where they'll send out invites at different times. That doesn't necessarily mean if you get a later invite that you aren't a top choice. It just means that the way that particular program did it, then you're sent the invite later. And so you're going to get a lot of invites along the way, hopefully. And when you do, you have to be able to figure out how you can schedule them. And we're in a bit of flux right now with some programs moving to virtual or staying virtual, I should say, and other programs moving back to in-person. And so that's something that obviously affects it a lot because you can't be two places back to back on one day after the other if they're across the country, if they're both in person, but if they're virtual, you certainly can. And so you have to try to get an idea early on who's doing virtual interviews, if those have a follow-up in-person interview or not. And it's different. It's changing year to year. So you have to get a good handle on that before you can start deciding how many interviews you can accept and how many you can fly to and start to consider other things like budget even.
Yeah, which is definitely a new landscape for, I think, this coming cohort and all of them moving forward, because before that, everybody was doing in-person interviews. And now this class is, I think, the first class that had all virtual during COVID. And so now kind of going back to the in-person interviews is a big transition.
Absolutely. Yep. So at Duke, we were doing virtual interviews, of course, during COVID, and now we're back to in-person this year. And a lot of programs are standardizing it one way or the other. That's it's been recommended not to do both by the ACGME, but in general, there's a lot of programs that are going to stick with virtual and then maybe they'll do a follow-up in person for certain circumstances. Some are going all in person like we are. And so it just depends. Each program is going to be different, but there's pluses and minuses to both. And you just have to consider, which program and are you interested in that program? And then that'll help you figure out if you need to take the interview or not.
So on the line of in-person interviews, do you have any advice for how to make the most out of that pre-interview social, like whether that's a dinner or whatever it may be organized the night before with the residents, or maybe there's attendings there?
Absolutely. Yeah. I mean, that's That I found a little awkward whenever we were doing them virtually because, you're all in a Zoom room together and it's kind of hard to pipe in and ask questions and not interrupt people. It was odd whenever it's virtual. But my thing is with those, if you're just with the residents, then it's a great time to figure out there's two pieces to this equation, right? One is it a good professional fit for you and your career desires? And number two is it a place that you would be happy? And if you have, a spouse or family or anything, would they also be happy there? And so I try to compartmentalize those a little bit to where whenever you're talking to the residents and fellows, maybe that's where you try to get a better sense of, is the place somewhere that you want to live and be, right? Would you be happy living in that particular locale as opposed to all the questions about the program that of course you want to ask the faculty, right? You don't want to ask you ideally don't want to be asking the faculty about the food scene there or whatever, right? There's a lot of other things that you hopefully are interested in programmatically that you want to get out of the faculty. But with the residents and fellows, the way a lot of programs design these, ours included, is that you want that time to be kind of protected, right? Where you can ask whatever types of things that you want legitimately about the program, not to get, undermine a source of information, but just to say, all right, here's questions that I want to know about what's it like being a fellow or a resident at that particular place. And there's a lot of different pieces to that equation, right? That includes things like, is housing affordable? How do you get to work every day? What's parking like? What are the rotations? How long are you there? For a 24-hour shift? What are your overnights like? All these things that everybody is interested in, hopefully, and wants to know, but maybe you wouldn't be comfortable asking the chair during your interview, right? Because of course everybody wants to sound like they're willing to do anything for the spot, and we know that that's the goal, but you don't have to be that way with the residents and fellows, right? By the same token, all the residents and fellows that you're at with these social things are going to have, in general, some say as far as their ultimate rank list and match list. But at least, my experience with these is that they're not after, what particular questions are you asking? Are they appropriate or not? Are you after working less? What they want to know is, are you interested in the program? And the people that we wind up seeing in perhaps a negative light from these interactions is whenever you're at the evening social, but you just are not interested. You're not asking questions. You don't seem to genuinely care or not what it would be like living in Durham, North Carolina, because then that gives us off the vibe. This is all a two-way street, right? We want you all, you want us, and we want to figure out, okay, are you figuring out if you would be happy here or not? The last thing we want is to match somebody who was expecting Durham to be a giant city full of high rises. It's not. It's different than that. Raleigh's a city nearby, but hopefully you can figure that out whenever you're talking with the residents and fellows, get a good picture of what it's like to be a CT resident or fellow here, and then decide if this place is correct for you or not. And so the fit aspect of it is a big one, and that's something that I think you can get from the social.
Hmm. And so I guess especially if they're going to be in person, maybe if you have the time, it would also be a good idea to just kind of drive around or take public transit around or whatever it is to just kind of actually feel what the community is like.
Absolutely, absolutely. And in fact, it's really helpful, I thought, to do that even on my own time, right? And not anything sponsored or set up through the institution, but perhaps, there's they give you a list of some neighborhoods around the area where a lot of the residents live. Well, why not at 10 p.m., take a little stroll around that area, either take an Uber or a taxi or walk over there in a way that you can figure out, okay, is this somewhere that I think is safe and I would be happy? Is it kind of my normal living space? Is it something similar to that? Would I be happy like that? That's different every single place you go. And I certainly remember interviewing at places where I liked the program. The program did a great job. They trained great residents, but it's not somewhere I wanted to live. And I knew that because I, spent some time trying to investigate what the living situation was like, and trek back and forth each day to work. You want to figure out, does that feel safe to you? Is that something that would be appropriate for you and whatever your situation is?
Thank you. That was like very comprehensive and I think tangible advice in terms of how to approach the pre-social really well.
And there's one other thing I'll add though to that real quick, because that I'll switch gears to whenever I was interviewing instead. That was one of the biggest things that I wound up ranking programs based on, was the turnout to that event, right? Because if there is a particular program where the residents don't show up to the evening before event, that means that they're either A, way too busy, or B, they don't care about what their classmates or other co-residents are going to be like. Those are bad situations. That should raise a red flag to you that perhaps those other residents aren't going to be interested in your well-being once you're there either, right? And instead, what you want is a good turnout and everyone to be interactive with you and interested in trying to get the best person. Because if you're at a program that's successful, they want other successful people there, and they want to make sure everyone's happy once you're there, especially if it's like an I-6, that can be 8 years together that you're spending with these people or longer. They want to make sure that they're with a classmate that's good and that they get along with. Whereas if the turnout's poor, like some of the interviews I can remember going to, if the turnout is poor at the social, then you really need to find out why that is, right? Perhaps it's circumstantial, but a lot of times it's not.
Hmm. Yeah, that is a really good point. Are there any other things to look out for from the applicant standpoint that are kind of like red flags during that situation?
Yeah, I think them not giving you adequate time with just the residents or fellows would be a huge red flag. And there's some programs where I remember thinking that when I did the interview that, wow, I interviewed with a lot of faculty, but I never really saw the residents in any capacity. That I think should be a huge red flag, because why would that be, right? Again, they're either too busy or they don't care. Those are really the only options. And so either of which should be a red flag. So you want to have time with the residents. You want to be able to interact with them. You want to see if you're a good fit for their group. And you certainly want to feel like they genuinely care about you, because when you're an intern there and you're struggling with something, you want to have other people that you can ask and get advice from, and you want them to be able to help you, right? And if that's not true at the interview, then it's hard to say that's going to be true later on when you're in residency there.
Mhm. That makes a lot of sense. Thank you for sharing that. So moving into actual interview day now, we'll kind of go into a couple common questions that people should really be prepared to answer well. So the first being, how do you advise people to approach the question of where do you see yourself in 10 years?
That's excellent, because a lot of interviews will get to that in some way, and it's a lot of pressure as a medical student to answer that correctly, because you think that there's a correct answer, right? Like, you think that you need to say, I want to be the chair of some giant surgery program, right? And that's what everyone wants to see. And I got to tell you, generally, people aren't that interested in that answer. We want to see that you have aspirations and drive, yes, but it's more of a probe to find something else interesting that we want to explore with you to continue that conversation, right? It doesn't make sense not everybody does have that desire, first off, to be a chair of some giant program or a chancellor of a medical school or whatever. That's not everybody's goal. But what we want to do is kind of start the conversation of, all right, well, what direction is your career headed? And I've changed to actually asking it that way, because it gives people a lot of open doors and options to kind of take it on their side in whichever direction they want, right? Do you want to be at an academic institution? Do you want to be at a private practice, right? That's a good distinguisher early on as far as how you see your career developing. Are you interested in research or not? Are you interested in education or not? Is there a particular focus within the field of CT that you're interested in, right? That's what a lot of people are trying to get towards, and they just want to see that you have a plan, right? Everybody should have a plan of some sort, but feel free to make it your ideal, right? If your ideal is to be a chair of a giant surgery program, then great, say that, but explain why. Be ready to explain why. Is it because you're interested in faculty development? Are you interested in the business side of it? Like, what brings you to say that, other than I want, fame and glory, right? Or prestige, like that's not the best answer. So you want to have some concrete things that you're interested in doing or progressing in your field that make people say, all right, that's good. Like, we want to help you with that, right? Because in general, residents that don't have a drive or don't feel guided towards any certain direction, they're more liable to kind of spin their wheels and even burn out sometimes, because there's nothing pushing them to say, I am doing this because I want to get to this next phase of your career, whatever that is. If you don't have a next step of your career in mind, then it's awfully hard to remember why, at 2 a.m. you're on hour 24 of your shift and you're still there, right? Whenever you really get down. And so, people who are driven, they got to have some goal that they are working after. And that's what we want to see. But it's more of an exploratory question. It's not a discrete, here's the right answer, and if you don't say that, then it's wrong. No, it's just that's your opportunity to choose which of the things is most important to you.
Mm.
Whether it's being a great private practice minimally invasive surgeon, great, you can say that. That's fine. If it's I want to train other people because I did a lot of that in medical school and that's an interest of mine, great, you can say that, right? But it's a good way to segue into something else that you want to talk about. So you need to have the other, branches of that conversation already planned out.
Mm. That is a great point. So, what would you do if you really do see something, or you think you may see something like in your future that you think you're striving towards, but you're a little bit hesitant, like, and perhaps you're a great person to ask this from the congenital perspective, or like private practice versus academics. Like you say to yourself, I think I really love congenital, but I'm not 100% sure. Like, how do you kind of emulate you're still interested in that and sound confident while still, being honest to the fact that you don't know?
Oh, that's great. That's a fine balance, right? Because you want to be able to describe to the interviewer what your goals are, but you don't want to sound like it's just a given, right?
Mm.
And in fact, that can come off off-putting, right? If you're talking to somebody who's been practicing for 10 years and they're still an assistant professor, then saying that, hey, I want to be a chair of a department, they may take that the wrong way, right? And because certain different people are in different circumstances. And so um, it depends on how the interview is going, which direction you want to take that, I would say.
Mm.
Um, you don't want to sound overconfident, but you do want to have goals, right? And you want to be able to describe those goals. And most importantly, you want to be able to describe why you have those goals and what your plan is to be able to accomplish those goals. That's all that matters. You
Mm.
never want to sound too overconfident, over certain that I am going to be this or that, right? I'm going to be the next president of the United States. Nobody wants to hear that, right? Because it's like, all right, well, that's good. But why? Why do you want that? Right? That's what you should really focus on, is being able to explain afterwards. Okay, here are my aspirations. I'm interested in this or that. Those are the things you want to be able to articulate in an interview. And you have to do it without sounding overly confident, but you have to be able to describe why you developed them and things that you've done to help prepare yourself to accomplish those goals.
Mm. Yeah. Yeah, it certainly is, I think, a fine line of doing that well. But I think the advice that you gave, just in terms of using it as a segue to kind of branch into conversations that you want to talk about, is maybe the best way to think about it, in order to kind of say what needs to be said while being true to what you really believe about yourself.
I think so. Yeah, and that's why I think it's best to go from a perspective of explaining why you have certain broad goals rather than discreetly saying, I want to accomplish, a R01 research award within 2 years of starting practice, right? I mean, you could say that, but people are going to be like, all right, well, I mean, that's hard. So what you meant to say was, I am very interested in research, and particularly, basic science or NIH funded research. And I want to set up this pathway to where I have mentorship to where I can do translational research in some fashion and get that NIH level funding so I can spend, a good portion of my career protected to be able to do research because I want to advance the field with this and that device or animal studies or whatever you want to do, right? I mean, that's how you approach it, to say, all right, well, I have a plan. I didn't just pick arbitrary goals. I have a plan to get me there, and here's why I want them. That's what the interviewer wants to hear.
Mm. And we'll do a lot of reviewing our application, but also some self-introspection to make sure that those things are really true to us and our path.
Well, absolutely. And practice with other people, right?
Yeah.
Practice with other people. There's no reason you can't practice with other medical students or residents. The best resource that you guys have are interns, right? Residents that just match, because they went through this. They have up-to-date information and they know what kind of answers worked well for them versus what kind of answers either backfired. I mean, everybody has stories of backfired answers, right? You give it and the conversation kind of takes a turn for the worse, or you're in recovery mode. Everybody has those experiences. I did too. And so, talking to other people about that and just practicing, I think, is the best way to make sure you don't accidentally stumble.
Mm. Yeah, absolutely. Okay, so kind of moving on to one of the big ones, and I think especially for students who are applying to integrated cardiac cardiothoracic surgery residencies. This is a difficult one to answer as a medical student, saying, I know I want to commit to this career in CT surgery. So how do you formulate a well thought out, why do you want to be a cardiothoracic surgeon?
Ooh, that's tough. That is tough because it is just so different for everyone. And I think, you know, you have to really think back for yourself of what experience made you seal the deal on applying for I-6,
Mm.
right? Why is it that you're doing that? And you can think back to an experience, probably, or a surgery that you saw, or a person that you worked with that led you down that path of saying, I want to do CT definitively and nothing else. And obviously, and that's why you're applying for I-6, right? It's very competitive. And everyone has that kind of, you know, setup or story that led them to say, this is the right field for me. And in particular, it's relevant for CT because you're not, you know, you don't do the surgery until you're, you know, later on in residency, right? It's not something like that is very easy to master or experience what the life is like of a CT surgeon as a medical student on a rotation, right? You can try, but you haven't really been in it, in the weeds of doing it and dealing with, you know, a lot of the impact and job, you know, specifics that can make it difficult. And so what you want to do is be able to describe what initially pulled you into the field, and then what things have you done since then that have proven to you that this is exactly what you want to do and not some other version of this? Because, you know, there's not a lot of bailout options in the I-6 program, right? If you decide you don't like CT and you're 3 years into and you're in general surgery, you go do something else. There's nothing like that for CT. You have to be sure that this is what you want to do. And so obviously we want people that are sure this is what they want to do, and you have to have enough exposure to it and a good enough reason to want to do it that we feel confident that you're going to stay in it,
Mm.
right? And so that's what your answer should circle around is, all right, why is it that you're doing this? Great, you know, great question, but all right, was there an experience that you had? Is it the physiology? Is it something that, you know, a surgery that you saw? Is it the technical demand? What was it that got you initially into here? A lot of that's going to be in your first personal statement in most instances. But then, all right, well, since then you've done enough rotations that how can we be confident taking you that you are sure this is for you? And that's what the question's getting at, right? It's getting at, have you done the obligatory prep work? Have you done enough rotations, met enough different people that do it, seen enough different surgeries to where you can confidently decide, all right, this is the next 8 years of my life minimum if I'm doing you know, an I-6 with research, and then the career afterwards, right? Am I driven enough that I'm not going to derail or change paths along the way? And so that's what you're trying to explain.
Hmm. So this really needs to be a very experience-based answer. Have
Absolutely.
have you
It's
ever
no pre-canned answer for this that's going to work. It's just
yeah.
not, you know, and you have to keep in mind everybody's going to be asking that question, and essentially your personal statement asks that question, and everyone's going to have different versions of kind of how they got there. But what we want to see is that there is a good answer to that question, that it is something that resonates with everyone, and it makes sense to where we can say, all right, yeah, you are going to do CT. That is something that's definitely what you want to do. There's no question. And once you start our program, you're going to go through it and finish it, and you're going to have an excellent career in whatever version of CT you want.
Hmm. Have you do you have any like common things that perhaps you've heard where someone's answered and they finished and you've been like, that really didn't answer the question well? Like, what things should people try to avoid saying?
Yeah, I mean, I think saying that having just a unipronged approach to that answer is generally doesn't work out that well, right? So people who just say, "Oh, well, you know, I think it's the most technically demanding surgery out there." All right, well, I agree, obviously. I'm in congenital. I think that that's true. However, there's a lot of surgeries out there that are pretty darn technically demanding. And so that in of itself isn't a good reason to do CT. You can make a lot of different types of surgery very technically difficult. So that's not really a good reason in itself. Now, I love the physiology of the heart and lungs. Here's why. You know, I think that there's a giant component of intensive care management for these patients. There's a lot more nuances to the intensive care. They're big surgeries, but they're more gratifying, and it's you know, there's a lot more parts to it, right? There's perfusion, there's the lung machine, there's a lot more. It's very interesting to be a part of because of the complexity. That kind of starts to hit on, all right, well, I've seen enough of these that I know that it's difficult, it is technically demanding, but all that together makes me want to do it. And I've seen enough of the different cases to know this is what I want, whether it's cardiac or thoracic, right? If you're on thoracic, then great. Have you seen enough? Have you seen foregut cases? Have you seen lung resections? Are you interested in cancer, right? Those are all the questions that you would want to kind of stem from in terms of why are you doing this? But everybody's answer is going to be a little different. What you don't want is just a simplistic answer where you give it and then the faculty is like, all right, let's move on to some other question because that wasn't interesting. You don't want that. You want to sound passionate about it because if you can convey a passion as to why you want to do it, then your patients and everybody else in the field are going to capture that passion and then they're going to carry that forward, right? And you're going to be much better attending because of it in terms of both training other people and trainees, eventually medical students, everybody. You want to see if you can do it for interviews, then you'll give that off whenever you're doing the surgery as well.
Kind of related to just one of the points that you were just making, if you're interested specifically in cardiac or specifically in thoracic, would you advise for students to still get exposed to the other one before going into your interviews? So that way you can talk about it at least a little bit.
Yes.
Okay.
Absolutely. Absolutely, 100%. I mean, half your CT is still a combined field.
Yeah.
And unless you're matching into a program that is, slotting you one direction or the other, then half your interviews are going to be with the other half, right?
Mm.
And so, I mean, you want to be able to be interested or at least seem interested in what it is they do, right? Because otherwise, that half of the interviewers are going to see you as a poor candidate.
Mm.
So
Yeah,
if
that's
you haven't
really
learned enough about, let's say you want to do cardiac, if you haven't learned enough about thoracic to be able to at least talk about the cases and ask legitimate questions like how many esophagectomies do you do a year? What's your approach? What type of different complex bronchoscopy do you do? Does your institution do robotic, nav bronch? All those kind of things that you have to at least be able to discuss to keep it interesting. I mean, I will say one of the worst things you can do as an interviewee is run out of questions or end the interview early because you're not interested enough, right? Those are the two worst things that you can do because if you can't seem interested enough to hold a conversation for 30 minutes, let's say, with somebody, how are you going to stand across the table from them for 12 hours a day every day for a month on a rotation, right? It's not going to work, and you're not going to learn. And so that's not what people want to see or hear, right? So you have to be interested enough in the other half of the field to be able to at least hold that conversation. I mean, it's relevant for me in congenital, right? Because not many people want to do congenital, but I'm still interviewing them. I'm still talking to them about it. And so if they say I have an interest in it, but I just haven't spent that much time in congenital yet, that's totally fine. I'm okay with that. And I think that's great. And that's an honest answer. And a lot of people don't have good exposure to it. And I see that as, okay, great. Well, that means whenever you're on rotation with us, you're going to want to learn. And we have a chance of recruiting you into our specialty. So it's not wrong to say I haven't gotten that much thoracic exposure, but you should be able to talk about thoracic, right? That's half your training. Or the other way around, right? If you're going into thoracic.
Yeah. No, that's really good advice. I think probably people get very focused on, okay, what's on my application and what are my interests? And I think you make a great point. Half of the people that interview you are not going to be doing what you are like planning on going into if you're planning on going into something. So that's a really good piece of advice in terms of prepping for the interviews beforehand.
Mhm.
Well, Dr. Overbey, thank you again so much for all of your time today and answering all of those questions. If you have anything else you'd like to share, we'd be glad to hear it, but also we're wrapping up our time here. So a big thank you regardless. I think you gave us a lot of tangible and implementable advice. So thank you today.
Of course. Yeah. Happy to help any way I can. And hopefully I'll see some of the listeners of this at a future interview someday.
Yes, and we'll get this posted soon. So thank you so much.
All right. Bye.